Hello friends, myself Rajeshwari. Today we will learn about Legionella pneumophila. Here, under this, we'll study about morphology, culture, biochemical reactions, susceptibility to physical and chemical agents, serogrouping, pathogenesis, laboratory diagnosis, treatment, and prevention. So, let's begin. In 1976, 221 cases of pneumonia occurred in members of the American Legion who attended a convention in Philadelphia. Hence, this form of pneumonia was named as Legionnaire's disease and the causative agent as Legionella pneumophila. The aerosols of water from air conditioning system lead to the isolation of the organism. The genus Legionella contains 40 species of bacteria. L. pneumophila is the most important species. In addition to this, other species associated with human disease include L. migdalii, L. bosemani, L. dumophi, L. gormani, L. longbeachi, L. anisha, L. birminghamensis, L. feli, L. hakeli, L. jordanis, L. wordsworthi, and L. tucsonensis. Now let's study about Legionella pneumophila. Let's start with morphology. L. pneumophila is a gram-negative bacillus measuring 2 to 5 micrometer into 0.3 to 0.9 micrometer. In infected tissues, it appears as a short rod or coccobacillus, but in culture it becomes longer. It is motile with polar or subpolar flagella. It is non-capsulated, non-sporing, and non-acid fast. It is a gram-negative but stains poorly. It stains better with silver impregnation method but is best visualized by direct fluorescent antibody staining with monoclonal or polyclonal sera. Now let's study about the culture. These are fastidious organisms and do not grow on ordinary media but require the presence of cysteine and iron for primary isolation. They are strict aerobe and grow best at pH 6.8 to 7.8 and at 37 to 35 to 37 degree centigrade temperature. They can be grown on buffer, charcoal yeast extract, agar, in short BCYE, and Muller-Hinton medium supplemented with ferric salts plus L-cysteine as essential growth factors. Colonies of L. pneumophila usually appear in 3 to 5 days, but some species may require incubation up to 10 days. Colonies are circular 1 to 2 mm in diameter, gray or gray-blue, and low convex with a so slightly irregular edge. Colonies have a classical cut glass appearance when examined under the plate microscope. With continued incubation, the colonies become larger and more opaque. Now, let's study about biochemical reactions. L. pneumophila is catalase positive and oxidase variable. It hydrolyzes hypurate starch and gelatin. Susceptibility to physical and chemical agents. Let's study about the susceptibility to physical and chemical agents. L. pneumophila is readily killed by 1% formalin, 2% glutaraldehyde, and 70% ethyl alcohol. It can be destroyed by 5 parts per million of available chlorine in 1 minute. Now let's study about serogrouping. L. pneumophila is divided into more than 14 serogroups. All these serogroups have been associated with human disease, but most infections are caused by serogroup 1. Now let's study about pathogenesis. The natural habitat of L. pneumophilia is water. The organisms have been isolated from cooling towers, air conditioning systems, humidifiers, whirlpool baths, sewers, and respiratory ventilators. These sources facilitate transmission of the organism to the human respiratory tract by generating infectious aerosols. Person to person transmission uh, has not been demonstrated. Legionella infection may occur in two main forms, which are designated as Legionella disease and Pontic fever, together known as Legionellosis. Now let's know about Legionnaire disease. It is a pneumonic illness which may also progress to involve virtually every system of the body. The incubation period ranges from 2 to 10 days. Patient develops malaise, fever, headache, myalgia, respiratory distress, and non-productive cough. Case fatality may be 15 to 20%. Smoking, alcohol, diabetes, immunosuppressive therapy, and pre-existing lung disease are risk factors for Legionnaire's disease. Now let's study about Pontic fever. It is a milder, non-fatal influenza-like illness with fever, chills, myalgia, and headache. Now let's study about laboratory diagnosis. Laboratory diagnosis of Legionella infections include microscopy. Now let's study about microscopy. Legionella can be detected in the clinical specimens, sputum, bronchial aspirate, pleural fluid, lung biopsy, or autopsy material by direct immunofluorescence test using labeled specific monoclonal or polyclonal antisera. Gram-stained smears are of little value as Legionella stain poorly. Now let's study about culture. Specimen is inoculated by on BCYE agar and incubated at 35 to 37 degrees centigrade up to 10 days. Bacteria from colonies are identified by direct immunofluorescence test with specific antigena. Now let's study about detection of Legionella antigen. Legionella antigen is the urine persists for months. This antigen can be detected in the urine by enzyme-linked immunosorbent assay, in short ELISA. This is a rapid and specific test for the identification of L. pneumophila in cases of pneumonia. Now let's study about serological test. Antibodies in serum can be detected by ELISA or indirect fluorescent antibody test. In short, IFAT, indirect fluorescent antibody test. A four-fold or greater rise in antibody titer or a high titer of antibody may be considered diagnostic of legionellosis. Now let's study about DNA probe. A commercially available kit of DNA probe can be used to detect the presence of all known species of Legionella in clinical specimens. Now let's study about treatment. Erythromycin is the drug of choice in legionellosis. Rap, Rifampicin and ciprofloxacin are also effective. Now let's study about the prevention. Legionella from water may be eradicated either by heat above 60 degrees centigrade or disinfection with chlorine or other biocides. No vaccine is available against Legionella infection. So you can research. Finally finished. Any questions regarding Legionella? You can ask me in the comment box and subscribe my channel to know more updates. Thank you.